Hello, hello. Welcome to another edition of Ask the Author. So, I am so honored today to be here with Dr. Philip Lister. He is an adult and child psychiatrist and psychotherapist, as is his wife. Liza is the second of their three children, and she died 25 years ago at the age of 6 after a 2-year journey with cancer. Dr. Lister works in private practice, often with families facing severe medical illness, and he turns his experience to the benefit of others. He also teaches the art of psychotherapy at Columbia and Mount Sinai Medical Centers, and he's a therapist in the phase 3 study of MDMA assisted therapy for the treatment of PTSD, which I feel like we could have a whole nother conversation about. um, Phil, I just want to thank you so much. Your book, A Short Good Life, Her Father Tells Liza's Story of Facing Death, is so beautiful. And I told you before I hit record that I just had such a um, visceral response to it because I could relate on so many levels. So I want to start with, even though we just said in the bio, something you talk about fairly early on in the book. When people ask you now, how many children do you have? What do you say? What is your response to that?
So I'd like to share a short poem that I wrote that captures my wrestling with that.
Okay.
It's called Counting.
Hmm.
If they ask, how many children do you have? I almost always know how many I have. I'm ready to shout or sing or say 3, not 2,
Mm.
3. If they ask how old she is, a simple question I brought upon myself, I don't know what to say,
Mm.
how to add 6 years alive and the time since. 6 plus 1 is usually 7. But now I don't know what to say, how to count. For a long time she was stuck at 6.
Mm.
But now she lies far beyond any single rational number.
Oh, that is so beautiful. If you are watching this live, please be sure to comment. We already have a comment from John Hope, and he says, "Thank you, Andrea and Dr. Lister. You're welcome, John." That's such a beautiful poem, and it is so hard because if you say 3, then, like you said, those other questions follow. I want to ask you another question, Phil. Why this story right now? Because your book came out, I think, fairly recently, and Liza died quite some time ago. So why this story? Why right now?
Well, I would say that writing has been a healing process for me. From the beginning, it was part of my effort to simply metabolize what was happening in the present.
Mm.
And that became a really valuable part of coping when Liza was terminally ill. I found my way to some kind of bulletin board and developed a few pen pals, people I didn't know, but they had already suffered the death of a child. And they were willing and able to absorb the anguish that I was facing
Mm.
and sort of be my companions. And I found writing helpful to me. And then when Liza had died, one of the things that concerned me was remembering. Would I be able to remember what had happened?
Yeah.
And I craved remembering everything I possibly could. And I also held out, not only was this for my benefit, because I didn't want to lose track of what had happened, but for my other kids, I wondered if one day they would ask with sort of a intense curiosity, what did happen? But
Right.
by then, my access to actually remember what had happened would be pretty skimpy, I feared. So I would create a document. And I started with episodes that were intense and vivid,
Right.
like the bone marrow biopsy or the day zero talk or things like that. And I captured them as vividly as I could. And then eventually it dawned on me that I wanted to capture the whole story as completely as I could.
Got it.
So that
So
took time.
so
And
I'm
it was,
gonna sorry, I'm sorry. I hate to interrupt, but so on that note, you made a very what appears to be a conscious choice that you wrote this story in the present tense. And that is not something that's easy to do, but I truly appreciate it because I wrote my story the same way. And now being on the other side as a reader of someone else's story, the beauty of present tense is that you are right there with you, like living it with you. I felt like, and I'm still, as I said, I'm almost done with the book, and I have to stop reading sometimes because I'm right there with you in your grief, and I cried last night. So these bags, these are totally your fault, Phil. So tell me why you made that choice to write in the present tense.
well, when I was first writing, I was trying different things. When it was a later stage to commit to trying to craft a book for an innocent reader who didn't know us.
Yeah,
And I felt that writing in the present tense provided the immediacy to bring the reader in. And if
yeah,
somebody was brave enough to tackle this book, they were game to be brought in. And
yeah,
so let's bring them in completely. And then a different strategy was to provide an offset, which are the sections in the book that are reflections,
yeah,
that are not written in the present tense. And they're written from basically the present of my life as a person who's 25 years out, thinking about what has happened, trying to distill some lessons as to what has stayed with me.
I think i- from a writing perspective and as an author myself, you did such an incredible job of that. I mean, really. And because structure is so important. And what I love about the way you did it is it was very, very clear, just the way the book is um, actually laid out, the use of italics at certain times. It was very, very clear when you were now in present time. And so as a reader, I appreciate it. And as a writer, I really admired it because I know it's structures everything, to quote one of my writing
Mm,
mentors.
mm.
And I just want to remind people, if you're watching on LinkedIn Live, sorry for the late start. I'm not even sure what the beginning first minute looks like, but sorry about it. But please, please, if you have any questions for Phil, please put them in the chat. If you're watching on YouTube and Facebook, we might not be able to see your comments, so we will follow up after. But again, if you're watching live, if you're watching later and you have a question, just please be sure to tag Philip Lister, and make sure he sees your question or comment. So I want to go into something that's a little bit happier, and certainly I just it helped lighten things up when needed. Liza loved cows. So, and didn't necessarily like people touching her cowie. So tell us about where this love for cows came from, because she actually wanted to have a cow in the house.
Right.
So tell us about the cows.
So the derivation of this is that I have a niece who was very, very attached to, for her, it was a polar bear, her transitional object. And her parents realized that she got very upset when that polar bear was not available. So they got a backup polar bear. So, okay, when we had Liza as a very young child, the Beanie Baby craze was on,
Yeah.
and she was very much enamored with the black and white um, Beanie Baby. So my wife, in her wisdom, at the candy store where the Beanie Babies were, got a bag full, like 4 extra Beanie Babies.
Backup Beanie Babies.
And they were all the same black and white cow in a little tied up bag in the closet. Well, Liza found the bag. So before long, she had all the Beanie Babies. And um, her affection for cows grew when um, when she was ill and friends wanted to get her something to give her a boost. Anything that was cow related was almost certain to be a hit.
Mm. Mm.
And at one point, um, I think this was before she was ill, she asked, why can't we get a real cow? I
And
mean, and
let's tell people where you live
yeah,
first.
we live in an apartment in the Upper East Side of Manhattan. So at that time, we had a little garden that we had access to. But from her point of view, the size of the apartment is irrelevant because her real life cow was going to be just as manageable as her Beanie Baby. And her devotion was going to be endless. So whatever it needed, she would provide.
It was almost like it was a dog for her, right? It's like, we're
Yeah.
gonna get a puppy and uh, um, so I have another comment I want to share with you from Ania. Hope I'm saying your name right. Halsman. She says in a response to how many children you have, my mom couldn't answer that question for 3.5 years after my brother's death. So I feel like you really just touched on something that everyone can relate to. And that transitions us really well into parenting through illness because you have Liza who has gotten sick. You and your wife are very busy and with private practice and everything you do, but you also have another daughter, Molly, I believe, who's
Right.
a couple years older.
3 years older. Yeah.
3 years older. So tell us how the system you guys came up with, because I thought it seemed like it worked really well most of the time.
Yeah. Well, um, we have we had a very fortunate situation in terms of our work lives because we were in charge of our own private practices. So I could schedule myself to be working on the mornings of Monday, Wednesday, and Friday, but stop by 2 and go to the hospital or, be on duty with Liza. And Elena could create an offset so that she was working when I was on with Liza. Um, and when she was in the hospital, we were basically a tag team. Um, the morning is very important, as you know, when doctors are making rounds and decisions are being made. So whoever spent the night would stay through the morning medical stuff
Yeah.
and leave late morning or early afternoon. Sometimes we'd hand off directly, sometimes there'd be a small gap, but mostly we were able to have it so that one or the other of us was there with Liza at the hospital. And um, the one who was at home would be having hopefully quality time with Molly. Um, and of course, from our point of view, we were having quality time,
Yeah.
but from Molly's point of view, it was a very strange and disrupted um, situation.
Yeah. Yeah, I'm sure it was. I know someone who same age gap. Her sister died from leukemia when her sister was 12. I think she was 15, and she really struggled during that time, just being the oldest and not having her parents' full attention. A tool that you guys used, and I did the same thing, was you had this sort of ongoing medical chart slash journal where you documented things so the parent who wasn't there could see what was going on. So how did you come up with that? Was that just sort of a natural way to stay organized? I'm just curious.
Well, we are both doctors and we're familiar with the medical rigmarole.
Right.
Um, and with one of us leaving as the other arrived, we realized shortly that, um, when doctors go off duty and hand off the workload to the oncoming doctor, there's a process called sign out
Yeah.
where they go over the tests that are pending, the plan for the day, and so on. Well, Liza did not want to overhear us having that kind of sign out. Please no.
Wow.
So that was a major factor in our developing a way to write what we needed to convey to each other, almost like kids in a classroom where the teacher was going to scold us if we were making too much noise. Um, so we used that um, that notebook to capture what the next person needed to hear on a medical side.
Right.
But more importantly, in a way, we wanted to share with each other the sort of poignant moments in terms of how Liza's imagination was at work, questions she was asking, dreams she might report, flights of fancy that were precious, and she wouldn't want to hear us talking about them, and we didn't want to lose track of them.
Yeah.
So we
Yeah.
put those down for the partner to see.
I think that was brilliant. And that kind of leads right into the next thing I want to ask you about. I call it the seesaw of medications. And I'm just going to quote you here because it's just perfect. And you talk about this very early on. We are on a merry-go-round of anti-leukemia drugs, drugs to offset the side effects of the anti-leukemia drugs, and other drugs to offset those. And that's exactly how I felt. It was, okay, she has to have this, but those are side effects. So we got this and this. So I would love for you to sort of talk about the difficulty because it really is this sort of constant seesaw. And there was a time when, well, many times, right, where Liza had some pretty severe side effects from very particular medications. Would you
Mhm.
elaborate on that?
If I can stand to think about it. Um,
Fair enough. Totally fair.
well, the first big problem was that um, she got infections.
Yeah.
So the infections are, in a sense, or the vulnerability to infection is the side effect of the immune system being knocked out, which is the goal of the chemotherapy. But then, with the infection in place, there's a question of whether the chemotherapy can be continued because you need to support the immune system to fight the infection.
Yeah.
If you interrupt the chemotherapy, then the cancer takes hold again, and the chemotherapy is less likely to be effective. So there's that kind of chase. Um, when she had her bone marrow transplant later in the process, um, one of the problems with the bone marrow transplant, in her case and often, is something called graft versus host disease, where the transplanted immune cells, the lymphocytes, recognize that Liza's body is not its body of origin and
Yeah.
make trouble. And for her, graft versus host disease was foremost a um, a rash that was itchy and sort of had a wild mind of its own. It would come and go unpredictably,
Different parts
and
of her body, correct?
different parts of her body. Yeah. So um, there were medications to try to ameliorate the graft versus host disease. The most prominent was a steroid.
Yeah.
Steroids make you crazy often and in a somewhat wild and unpredictable way. So there was um, that kind of problem. She had, at that point, with our medical center, a kind of novel treatment with ultraviolet light to attempt to quiet down the rash and the itching. So it was a process where over and over we've got a new problem. We can't easily get away from it because it's part and parcel of the treatment. So let's add something, if possible, that might quiet it down.
Yeah. It just seemed like it was constant. I mean, this
Yeah.
cut. So you were just setting me up, and you're like setting me up for these questions beautifully. Before I ask this next question, if you are watching live, please give us a comment. Tell us where you are, what you're doing, and also any questions you may have for Phil. If you're watching live on YouTube and Facebook, we might not see it right away, but I will be sure that Phil sees your question or comments. And again, we're sorry for the rough start, but so I would like you, let me back up. I know what a BMT is even before my sister was ever diagnosed with cancer because my mother was a nurse. And so I was familiar with the term and I guess the process, but for some reason in my head, I thought there was some sort of surgery involved with the actual BMT. And the way you describe it, not only was it not a surgery, but it seemed like um, in that period of time where you had to do all that other stuff first to wipe out I think it was chemo and radiation to wipe out her bone marrow, that seemed a lot more difficult and taxing than the actual bone marrow transplant. So tell us what that actually entails, the BMT.
Well, it is 25 years ago, and the technology and process might have evolved to some degree.
We hope.
It's possible that you're reacting to the word transplant, which
Yeah, I am.
is most associated with kidney transplant, lung transplant,
Yeah, an
heart
organ.
transplant, right?
Yeah,
And that is definitely major surgery.
yeah,
For leukemia and for Liza, um, the process is, as you say, preliminarily to have the most severe chemotherapy and total body irradiation, which in combination are meant to um, destroy her immune system,
yeah,
and then provide a donor's immune system, which is done through an infusion, an IV infusion. And the bone marrow has been collected and processed in some way before it is infused. So it's like a blood transfusion or an infusion of another medication. It's put on an IV pole or done slowly with a very large syringe, watching her vital signs. But it was kind of anticlimactic.
that was the word I was going to say. It seems like it was
Right.
after all of that prep.
Because she's moved to a special unit. She's had all this experience. Her companions are now gowning in a, like a surgical scrub kind of situation. So the environment has changed. It's bizarre. All the caution to keep her safe is maximal.
Yeah.
And then the thing we've been waiting for and building toward for months is somebody coming in and using a syringe. And
I'm so glad you said it because that's exactly. I was like, wait, that's it? Like, and
Yeah.
I immediately highlighted, put it in. I was like, I need to ask you about this because that's it.
and there's a moment where some of the nursing staff who were assisting are, like cueing the orchestra to have its, crescendo. And now you've had the transplant, but for Liza, this is like, this was nothing.
Yeah, yeah. All right, so I want to talk about anger. I'm just going to read some of the lines because and I'm talking specifically about being angry at the disease, the circumstance. I am livid at the fact of leukemia, but I don't know how to argue with it. So I gripe and bicker with Elena instead. And that's your wife. Later, you say, I want to personify leukemia so I can go scream at it, fight with it, but there is no enemy to shout at. And I've got some other highlights here. I felt the same way. I felt like to be angry was to be angry at this cancer that we couldn't even see, that we didn't even know existed, the few weeks before. And so I don't feel like a lot of my anger really occurred about the disease until later. We'll talk about doctors and nurses in a minute. So, but talk about that feeling of being angry at leukemia.
I'm not sure exactly what to say. I think I experienced a struggle between hopelessness and rage, both as kind of responses to an enormous challenge in which I felt like I had very little power to make it go away.
Right.
So I think anger is a sort of natural reaction to that kind of quandary. But where's the target?
Yeah. Exactly.
There's no target. So the anger needs another outlet, or it needs to be converted to some mission. For us,
Right.
it was the day-to-day of trying to optimize family life and keep Liza safe and take care of Molly and take care of one another.
And talk about Liza's anger. I realize the steroids definitely um, inflamed that, but I think even without the steroids, she might be angry. Talk about how she expressed her anger.
Well, um, there are numerous episodes, and it sort of arose at unpredictable times. Um, one kind of angry response was in the hospital where she had limited control of how people would talk to
Mm,
her or in her presence. Um, it was upsetting when people would come into the hospital room and start talking to us as though Liza had no mind and no capacity to understand what was being said. Um, Sometimes she reacted to that in a sort of sunken and sullen, fuming fury. Um, Sometimes she would pipe up and say, can you guys stop talking
yeah.
or talk outside of the room? If somebody came in and, in a well intentioned effort to make a friendly contact with Liza, picked up one of her stuffed animal cows, um, she was often angry that that was not a respectful way to treat her stuff.
Yeah.
If somebody came in and said, Liza, may I, you know, see one of your cows? Totally different,
Yeah.
totally winning approach.
My sister was learning how to play jazz bass. And so my boyfriend, who was very much like a father figure to her, brought her jazz bass to the hospital thinking it would make her feel better. And because it meant so much to her, and people just picked it up and started playing. There were a lot of musicians in our lives at that time, and it made her so mad that people were touching her precious bass and not even asking her. She said, "Take it home. I don't
Mm.
want to hear. I don't want other people touching my bass." Um, so that really stuck with me.
I can share one other anger vignette if you want.
Would you mind sharing the one about Molly?
Yeah, that's the one I was going to share. At least the,
God,
the
that
one around where she held her in a headlock.
yeah,
Yeah.
that was tough to read. Tell us about that.
A friend of ours was visiting from out of town, and um, she wanted to spend some time with Molly, sort of devotedly one on one. And um, they had a plan to go toss a ball on the sidewalk. So Molly went over to where Liza was posted, sitting in her sort of most frequent spot on the sofa, saying that she was going to go outside and would be back in a while.
And
Uh,
just so people know, this is after she's already had the bone marrow transplant. So
Um, right. So something like going outside to toss a ball is something Liza couldn't do
right,
because she had to take precautions in terms of infection control.
right.
So Liza put her arm around Molly's shoulder in what began as a friendly embrace, like, see you later.
Mhm.
But then she held on and wouldn't let Molly go. Liza becoming more and more forceful in holding on to Molly. And um, Molly big and strong enough to pull away, but also feeling it seemed uncertain whether to be so forceful and look to us. We were all around.
Right.
And um, what ensued was our coming over to the two of them and removing Liza's arm from around Molly and um, asking Liza what was going on.
Yeah.
And Liza let loose.
Mhm.
Nobody understands what this is like for me. And
Yeah.
then we sort of invited her to tell us what's it like. And she had a litany of complaints about all the medicines and all the dietary restrictions and all the restrictions on her day to day
Mhm.
freedom, which we heard out. And she was mad as hell.
Yeah, none of you even care what this is like for me. Yeah. Yeah, I highlighted that whole passage. Mm. So I'd like to ask you about miscommunication because it happens. It does. But sometimes it can be pretty extreme. And for example, there was a time where my sister had an allergic reaction to Benadryl, and when it happened, no one put it in her chart.
Mm.
And so one of our favorite nurses ended up giving her Benadryl like within a day later. And it was just, and she felt terrible. It was this disaster, but it was certainly an innocent mistake. The previous nurse should have put it in the chart. Um, there were many, many occasions, but the one that really jumped out at me is when a doctor, I can't remember if it was a resident or not. I think was it Valium? I know it was 30 milligrams, and you heard that and you were like, whoa, what? And it was supposed to be 3 milligrams. So can you tell us about that incident?
Yeah, so we were at the second hospital. A new chemotherapy agent was being started. Um, the nurse came by, and the custom that everybody understood was usual with Liza was that the nursing staff would leave the medicines with whichever parent was on, me or
Right.
Elena, and then we would navigate um, giving the medicine to Liza with chocolate syrup or whatever the method of the day
Brilliant,
was.
by the way.
So this was a new medicine I hadn't seen before. I had known that a new medicine was coming, but it seemed like a lot of pills. And just on intuition, I gave all the others. I held this one back. I wondered, and before giving it, um, you know, press the button on the wall. It's this kind of strange way of communicating to a wall to get to the nursing station, saying that I had a question about this medicine. The sort of terse answer, slightly irritated, was okay, but the nurse isn't going to be able to get back to you for whatever, half an hour. She finally did come by. What's the problem? This really seems like a lot. Do you mind checking? So she went and did check and then came back a few minutes later saying um, it was a mistake. It was the improper amount. 30 milligrams is what she had given us, but only 3 milligrams is what was prescribed.
Oh my
It's not her mistake. Somebody made a mistake transcribing the doctor's orders. It was sort of the disturbing part was not just the fact of the error, but her attitude in dealing with it, which was sort of surly, snappy, um, annoyed, and not in the least empathic with what it's like to be the recipient of 30 milligrams when 3 is the right amount. It's
Yeah.
terrifying.
Yeah.
And
I can't believe she didn't question it. Do you know what I mean? I mean, we're not talking about a 250-pound man. We're talking about a little girl. I just yeah, and again, you just like teed me up. So you experienced what I call the nurse bitchy effect. So we had a nurse bitchy, and she never ever worked with my sister again. But I just want to read some of these things. So one doctor said to you, I find you a difficult parent to deal with, and you should realize Liza requires careful monitoring. It's inappropriate to question the resident's judgment or judgment of any of the doctors. Sorry, I don't mean to laugh. It was like, what? And then I'm trying to find my other one that just there was more than one. Let's see. I so want to find it. Oh, here we go. And then this is you at a later with someone else. My anger at him and at this biopsy is a diffuse anger against all the doctors. This is great. Who are arrogant, aloof, omniscient. I never say this word right. Omniscient. I know what I mean. Insensitive and ever ready to assure that what they are doing, quote, won't hurt too much. So tell us about some of these interactions. I just can't believe the one doctor said that, you're a difficult parent. I, it's your job to protect your child. So
So that situation stands out vividly. It is one where Liza's body was swollen all over. So accessing a vein to take a blood test, an ordinary blood test, usually a simple procedure, was particularly difficult. And a medical student was sent in to get a blood test at around midnight. And based on experience in medical training, I knew of something that is referred to as treating the chart rather than treating the patient. So there was a blood value.
Interesting. Okay.
There's a blood value that came back that was out of whack. And it was almost certainly a lab error. But it's very uncomfortable for the team to leave that abnormal value on the chart. And let's check it again as soon as possible so that the chart is correct. But if it were easy, that's one thing. But for Liza, in the middle of the night, where her body is swollen and it's very hard to get access, it's not so simple a matter. So
Yeah.
I concluded perhaps, this is something that can be criticized, but I concluded that this was not in Liza's interest. It was in the chart's interest,
Right.
and in the comfort of the doctors on call.
Yeah.
So I complained and asked if it
you.
could be waited, if the repeat blood could be done in the morning when the standard blood draw would be done. And the resident, the medical student told the resident talked to me and told the fellow. The fellow is the one who came at about 2 a.m, irritated at being, bothered with this, and that's the one who addressed me down.
I would have thought that just being a doctor yourself, you would have gotten a little more respect, but I guess it didn't work that way.
It did with many people, but not with this one.
No.
And I think this person had recently had the experience of having a family member die of cancer themselves, and that in some way informed their reactivity to me, I'm sure.
You're being very generous, by the way. That's possible. There's a point where Eliza takes a turn for the worse. I think you talk about entering this new world of medical care. I believe this is when the leukemia came back, and you had to change things. I mean, when you came home, I wrote this down. I was like, we had to do this too. They had to get rid of 3 of their biggest stuffed animals. She slept in her room by herself with a HEPA filter. Actually, maybe leukemia hadn't come back yet, but certainly the coming home was very different, and there were a lot more pieces to put into place. And so I would love for you to talk to us about that.
Yeah, that was after the bone marrow transplant. We were optimistic that it would work,
right,
but the level of care and caution that we needed to take at home was new. That's why the stuffed animals had to go. That's why Molly and Liza couldn't share a bedroom anymore, because Molly was going to school and school was germy, potentially. So Molly took over Mom and Dad's bedroom. We slept downstairs in an office, and then that's also, as I recall it, the time span where Liza could not go outside to be in the garden or to toss a ball around, and where that encounter that we were talking about before happened.
Yeah. And she had numerous, I think we just called it her central line or port. I mean, there are different names for that tubing that goes in that makes it easier so patients aren't pricked constantly with an
Right.
IV. Brof Broviac, is that how you say it?
Broviac.
Broviac. Um, I She had many, many times where it would be infected or because she was taking one medication. So am I correct that she had it replaced 3 or 4 times?
Yes. Yeah. And when there's an indwelling catheter, it's called a foreign body, and
Yeah.
any foreign body is vulnerable to be a site of infection.
Yeah.
So that's what happened.
Wow.
Yeah.
Wow. So before we wrap up, again, I want to remind people if you're watching live, please comment. And if you're watching later, which is what usually happens, please comment and tag Phil. So if you have any questions for him, but also so he can see it. And I just want to share, I have not completely finished the book, but I want to share what my favorite line in the book was so far, from truly just a writing perspective, not the story, because some of the best lines in the book are definitely from Liza, hands down. So, I mean, I'm still talking. I still have hospital instead of hospital in my head, which was really spot on the way she phrased it. But there were so many times in the book where you directly quote her, and she's just so insightful and brilliant, especially for such a young child. But in terms of just a piece of writing, this line was perfect. So I want to read it and then I want you to tell us who the heck it was about. Like a towering Iowa cornstalk, she evokes bright sun and blue skies. I felt like I knew immediately who this person was. So can you tell people listening who this person is?
This was the head nurse on the bone marrow transplant unit. And we met her when we were going on a sort of visit to see the new world that we'd be inhabiting in the hospital. And a lot of anxiety attending that visit, um, and hope and excitement for good things to come. But she was such a powerful and reassuring force, and very much uplifting. And even when we encountered some difficulties, um, having her at the helm of that unit was fantastic.
Yeah. In that one sentence, you conveyed it perfectly. Kudos to you. Just
Thank
it's
you.
brilliant. Yeah. Oh, and it's brilliant. So I want to wrap up with some sort of hard topics, and I put together a couple of different phrases here that are throughout the book. Um, you talk about, if life is about loss, then grief is the cost of love. Actually, there's a kind of two different things, but you talk about loving someone so much, and then having to grieve that loss. And I really want to find like the full thing that just really hit me hard, but I'm not sure if I can. Yeah, this is the part that was really hard for me. And as much as I can relate to everything you guys went through as parents on very specific things, um, this was the hard part for me. So, and I think you say at some point about how grief really doesn't even go away. So, can you tell us your thoughts on that?
Um, I don't know exactly where you're quoting from. I think I would claim that life is about love and grief is the cost of love. So um, they're inextricably bound up.
Yeah, yeah,
Um,
yeah. You say if grief is the cost of love. Oh, here it is. Oh, maybe the capacity for grief is just limitless. Ah, ah. The life is about loss was perhaps later, but I didn't highlight where it came from. Yeah, it's on page 175, but I can't remember the context. I just put,
okay.
um, so talk to us. God, I'm trying so hard not to get upset. About all these years later and still having grief.
Well, it's just, um, I want to stay connected with Liza despite her absence.
Yeah, of course.
And that is a bittersweet prospect. There's the sweetness of her, and there's the pain of her absence, and they're together, and there's not one without the other. So I'd rather feel all that than not feel it.
Yeah.
And
There's this movie with Amy Adams, very weird sci-fi movie, that people told me not to see because they thought I would get upset. And I can't remember the name. It's like a one-word title. But basically, she's a scientist. These aliens come, and she's the only one that can talk to them, right? And time doesn't really exist in their world the way it does for us. Do you know this movie? Do you remember this movie?
I can picture something
Yeah.
about it. Yeah.
And spoiler, not that I remember the title of the movie, but spoiler for anyone who might go watch this movie because it's a big spoiler. And in encountering these beings and translating what they're saying and understanding, she becomes sort of part of their world in time, and she is able to see the future. And she is able to see the scientist that she's been working with and arguing with will actually end up being her husband. And she's able to see that they are going to have a beautiful daughter together. And she is able to see that their daughter is going to die, I believe from leukemia. And it and then they get divorced. And she is able to see all of this, and they haven't even started dating yet.
Mm.
And the thing about that film that really got to me, not in the way people thought it would, was I think it really begs the question, if you know how it's going to end, and you know all this grief and sorrow and pain and anger, and it's all coming, would you do it all over again? Because in that moment, she really had a choice.
Mm.
And I would, I would. So what about you, Phil? Would you do it all over
Well,
again?
you're reminding me of a moment when Elena and I were leaving the hospital. At some point, we had the chance to catch up with one another, and we had heard the prospects of, if the leukemia comes back, there is such a thing as bone marrow transplant. It was early in the process, but we were already hitting some bumps in the road.
Yeah.
And I remember it was a cold day because my eyes were watering, and it wasn't tears, but it could have been.
Mm.
And we spoke about, if she dies from this, would we want it to just be over now, rather than subject her to all the horrors of
Yeah.
infections and chemotherapy? And I mean, we wouldn't want to have missed a minute with her.
Right. Right.
So.
Mm. And just to wrap things up, remind people again, please tag um, Phil in the comments. If you're watching this on YouTube and Facebook, please reach out. The book is fantastic. Tell us where the title of the book, A Short Good Life, came from.
The title came from Liza's mouth, and one of those astonishing moments, of which there were many, where she, in a offhanded sort of not momentous way, just commented that she has had such a short good life. And it was just sort of like hitting a pause button, like everything stopped as I heard that. Like, did she really say that? And what a model for appreciation and gratitude.
Phil, I want to thank you so much for doing this live interview today, despite all the technical snafus, and just want to remind everyone again, if you're watching this later, please be sure to reach out to Phil, and please be sure to get his book, A Short Good Life. And Phil, why don't you tell people where they can get in touch with you, and then we'll say goodbye.
Well, I guess the hub would be the website that is associated with the book, which is called ashortgoodlife.com. There's buttons to press to communicate with me by email. There are buttons to press to order the book if you're interested or to access the reader reviews. And there's some supplementary photographs as well as um, some amusements that relate to Liza and her affection for cows.
All right, so please reach out to Phil, ashortgoodlife.com, and we will see you again in 2 weeks for another Ask the Author live interview. Thank you.
Thank you, Andrea.
Oh, and thank you for watching, Peter.